Alright, hello everyone, this is Dr. Kashish Grover, your PSM faculty. My greetings to everyone, hello everyone. So how is the audio visual? Please write in the chat box, how is the audio visual? Guys, how is the audio visual? Good evening everyone, a very good evening to all of you. How is the audio visual? Please write in the chat box. Are we good to go? Guys, are we good to go? Alright, so guys, greetings to everyone, hello everyone. Alright, so now I'm going live and we are going to discuss. Okay, just give me 1 minute, let me settle it down. Now, okay, so audio visual is fine. Guys, we are now discussing our block 1 topics. In block 1 we discussed entomology, vector-borne disease, zoonotic disease. So after giving quizzes, after giving daily quizzes, this is my idea to wrap up the things quickly, right? So here I'll be doing the wrong question analysis. We will be doing the questions which we marked wrong. Hello everyone, yes, my hello to everyone. Yes, bacho, my hello to everyone. Now, yes, boarding started. Dr. Sonal is writing boarding started, right? Now, bacho, coming to the first question. Guys, in this session, my main focus is your keywords, right? In this, the main focus is keywords. From where you should revise PSM, you can check my back to basics and my DVT and PYQ session, right? DAMS DVT PSM is done in 2 halves. One is done by me and another is done by other faculty, right? So now, first question. So guys, this is going to be a very fast session and my focus will be here to only and only discuss the keywords. Quickly, question number 1. 32-year-old farmer presents with headache, myalgia on examination. The ishar is there which happened because of insect bite. So whenever you get question ishar and insect bite, ishar and insect bite, whenever you get ishar and insect bite, this is the case of scrub typhus. This is the case of scrub typhus. This happens because of what is the agent here? Agent is Rickettsia. The agent is Rickettsia susugamushi, right? And the vector here is trombiculid mite. Trombiculid mite. The drug of choice, the drug given here is doxy. The drug given here is doxy. So here the correct answer is doxycycline. The correct answer is doxycycline. Now coming to the next question, guys, keywords. Focus on keywords. In this question there is a patient who is immunocompromised. In this case the patient is immunocompromised but previously vaccinated and now again bite by a stray dog, right? Now they are asking you how would you manage. So guys, first of all, this image was given. This is a category 3 bite. This is a category 3 bite, right? I want to tell you, whenever you have a immunocompromised, whenever we have immunocompromised case, in rabies, IM is preferred over ID, right? So here IM is preferred over ID. So here the patient is unvaccinated, previously unvaccinated, immunocompromised. So previously unvaccinated, category 3, we need to give full post exposure prophylaxis. But here the case is intramuscular. We will prefer here intramuscular. Intramuscular will be preferred here because the keyword is immunocompromised. We prefer intradermal except if the case is immunocompromised, like here. Now, coming to next question. In this question, the case is previously vaccinated, but now coming with category 3 bite, right? Now coming with category 3 bite. So this is the case of re-exposure prophylaxis. Guys, what is your answer here? What should be the answer here? Yes, everyone, what should be the answer here? Okay, let me check how many are answering it. We have attempted this question. Yes, Dr. Sneha is right. Very good, bacho. What should be the answer here? According to you, what should be the answer here? So this is a case of re-exposure, and when there is a case of re-exposure, 0. Okay, someone is writing D, someone is writing C. Okay, PEP is not necessary. No, this statement is not true. PEP full course. Why? What is the need of full course? No need of full course. PEP course should be administered immediately. Immunoglobulins. PEP 2 doses 0 and 3 should be administered immediately without. So this is the case of re-exposure, and in case of re-exposure 0 and 3 is given. Okay guys, do we need immunoglobulins here? In case of re-exposure, immunoglobulins are not needed. Okay, Dr. Bhavya is asking with immunoglobulins. No, without immunoglobulins. In re-exposure, we do not give immunoglobulins. Only 2 doses are given. Okay, now I have one question. If the re-exposure within 3 months, then what will you do? Within 3 months, what will you do? Yes guys, if within 3 months, what will you do? Only wound care will be given, right? Sorted? Guys, this is important. This is very important, confusing, very, very important. Okay, Dr. Bhavya is asking if previously the patient received immunoglobulin, did not receive immunoglobulin, it does not matter, right? If previously only vaccine was given, immunoglobulin was not given, now immunoglobulin will not be given, right? Now immunoglobulin will not be given. Now coming to this question. So joint pain, there is the case of joint pain with hepatomegaly. Guys, fever, hepatomegaly with backache. This is the case of brucellosis. Now this brucellosis is mainly seen in cattle like cow, sheep, and in this case, who is the host? Usually it affects adult male, those who are farmers, those who are butchers, basically animal handlers, they get the disease. Yes, Dr. Pranjal, irrespective of immunoglobulin, in the past we will not give immunoglobulin, right? Now sacroiliac joint. Now this is the case of brucellosis. Now bacho, if I talk about the brucellosis control, number 1 is vaccine for both animal and the person who is at risk. Number 2 is pasteurization of milk. You should never consume raw milk, because if the buffalo or cow is infected, right, this can pass on with the milk. Personal protection, protective gears should be used when handling animals. Guys, there is one option, rodent control. There is no rats involved in the transmission of brucellosis. This disease purely spreads from from the cattle to man, right? There is no rodent involved. So that is why B is the correct answer. That is why B is the correct answer. Now guidelines say that this can be, the WHO CDC guidelines say this can be attempted, but rodent control is never answer here. It is not involved. Now bachcho, if you get in option rice field, floods, heavy rain and rats, so 3 are rice field, rain, rats, rodent, and 4th are rat flea. This 4R is the mnemonic for leptospirosis. This 4R is the mnemonic for leptospirosis. So why slaughter? The guidelines say to break the transmission. Right? Yes, RRR. Ananya Gupta, very good bachche. RRR. So this is Leptospira. Quickly. Now, bachcho, coming to next one. So in this, they are asking you uncomplicated Vivex. They are asking you okay. If they ask you this history and the options are this, which is the best way? Here, rodent control is the answer. And zinc phosphide is used for rodent control. Now here the answer will be rodent control in case of leptospirosis. Guys, I need a quick feedback in the chat box. Is the speed good? Am I going too fast? Right? If everything is good, can I get some smileys in the chat box just to know that you guys are awake? Can I get some smileys in the chat box if everything is good? If you want me to increase or decrease the speed, you may let me know. Okay, sir, my PSM is strong all because of you. Thank you, bache. Thank you so much. Just a small part in your big journey. Now, bacho. Okay, good. Perfect speed. Now bacho, in this case, uncomplicated Vivex. So whenever we have uncomplicated Vivex, we give chloroquine and primaquine. Chloroquine is given 25 mg per kg in 3 doses. So basically chloroquine is given for 3 days, and in 3 days we have to give 25 mg per kg. So day 1 10 mg per kg, day 2 10 mg per kg, day 3 5 mg per kg. This is how we give chloroquine for 3 days. Primaquine is given for 14 days and the dose is 0.5 mg per kg. It is given for 14 days and this is given for 3 days. Now, very good bachche. Akshat, Dr. Sneha, Dr. Pranjal bachcho, very good. Now, okay, some students are saying increase the speed. Sir, don't delete stream please. Yes, the live stream will be there for the recorded one because many students are there. Bachche, Ekadashi is asking why backache. But this is a feature. This is a feature which is seen in brucellosis, fever, and backache. Joint pains are seen in brucellosis. All right. Yes, Dr. Fani. Okay, just be with me, guys. I'll discuss everything. You need not to worry about prophylaxis of malaria. I'll discuss everything for next 25-30 minutes. Just be with me. You need not to worry about anything. Just take your seat belt and let me finish it, right? All right, good. So bachcho, in this case, I have given you, there is a case of northeast. So now there is a patient from northeast And you won't believe majority of the students, just by looking northeast, they rushed to mark ACT-AL. But that is not the correct answer, because here it is not northeast falciparum. It is for vivax. For vivax, be it northeast or other than northeast, the treatment remains the same, chloroquine and primaquine, because here it is not falciparum, it is vivax. Okay guys, according to the National Vector-borne Disease Control Program, quinine can be used for severe malaria, artemether, artesunate, arteether, these can be used, but among all the best answer is mefloquine. Among all the best answer is mefloquine. Now bachcho, again the keywords. So Indian Army, from going one person from Indian Army going to Africa for 5 weeks, and they're asking you about malaria prevention. Guys, listen to me very carefully regarding malaria chemoprophylaxis. According to National Vector-borne Disease Control Program, only 2 drugs are given for malaria prophylaxis. One is doxycycline, another is mefloquine. Now, sir, can we give chloroquine? Yes, you can give chloroquine, but it is not as per National Vector-borne Disease Control Program, because it may lead to the resistance. Now, question number 2, sir, everyone is entitled for taking chloroquine prophylaxis or doxy prophylaxis or malaria prophylaxis? No, it is only and only for people who are traveling to endemic area. For people like you and me in this country, it is better to use bed nets and to control the vector, right? Now, if someone is traveling for less than 6 weeks, and if someone is traveling for more than 6 weeks, if someone is traveling for less than 6 weeks, doxy is given daily. Doxy is given daily. But if someone is traveling for more than 6 weeks, mefloquine is given once a week. It is given once a week. 100 mg doxy, 250 mg mefloquine. So here I have given this history deliberately to tell you the keywords about chemoprophylaxis. Now here it is only for 5 weeks. The best answer here is doxy. The best answer here is doxy. RK39. If RK39 is there, then they are talking about Kala Azar. And here liposomal amphotericin B is the drug of choice. So guys, here I have given ACT-SP. This is for falciparum treatment. This is for falciparum treatment in other than northeast. So here the best answer is other than northeast. Now coming to this question, MDA. So MDA contraindications. What are the contraindications of MDA? Less than 2 years, pregnant, and seriously ill, or you can say severe serious cases. MDA is not given in these cases. Guys, MDA contains, the mnemonic is IDA. What is IDA? Ivermectin, DEC, albendazole. In the areas which are endemic for filariasis, this is given, right, to everyone in that area. To everyone, these 3 drugs are given to everyone living in endemic area. The exceptions are pregnant, less than 2 years, and seriously ill patient. Now, so the mosquito larva with no siphon tube. Guys, Anopheles mosquito, it has no siphon tube. But other than Anopheles mosquito like Culex, Aedes, Mansonia, the larva contains siphon tube. So the only mosquito with no siphon tube is Anopheles, and the disease caused is malaria. Now, when disease agent does not go any cyclical change but multiplies, guys, at this point I want to decrease my speed. Guys, listen here, just look here. Guys, this is the vector. Just imagine this is a vector, right? And this is a vector. Just imagine this is a vector. And okay, so this is the vector. In this vector, the agent is entering. Right? And if it is only multiplying, like suppose one egg is entering in a mosquito, and the mosquito is spreading the disease by shedding the eggs of that. Getting my point? Something like that. This becomes propagative. No cyclical change. Like it is not changing its stage. Only and only it is multiplying. This is propagative. Now just imagine if we have something where one agent is entering, inside, and it is changing its cyclical shape. So suppose egg entered, now larva, but not multiplying. This is cyclodevelopmental. And suppose if the agent is entering inside the vector and now it is multiplying, it is not only multiplying but also changing its cyclical shape, like from egg to now larva, or to larva to something else. If it is doing both, then it is cyclopropagative. Many students, they ask me this doubt again and again, right? Now you tell me this question: does not go any cyclical change but multiplies. So here the answer is propagative. The mosquito with star-shaped cluster egg, they are seen in Mansonia. Now, copper. Okay, so this is Paris green, and Paris green is a stomach poison. This is used to kill Anopheles larva. Only 3 things you need to know about Paris green. The other name, it is a stomach poison, and this is for Anopheles larva. Basically, this is a larvicidal, right? Paris green. For Chagas disease, red-winged bug. For oriental sore, sandfly. Not transmitted by hard tick. It is relapsing fever because it is transmitted by soft tick. Now, guys, this is a previous ionized set question. This is known as raft-shaped egg. And they are seen in Culex eggs are raft-shaped. Okay. Now I'll do it. I'll compile it later. Don't worry. Now, guys, this is a itch mite, and it causes scabies. Again, the controversy. Guys, listen to the keywords. Here the keyword is heavy rainfall. They are giving doxycycline. Whenever there is heavy rainfall, whenever there is doxycycline, we suspect leptospirosis, and the rodent control is the only best answer here. According to me, the best answer here should be zinc phosphide. It is commonly used for rodent control. If anyone of you belong to a family where the background is agricultural background, you talk to your parents, your grandparents, your uncles. Zinc phosphide is commonly used rodent in fields also, right? According to me, the best answer should be zinc phosphide. Guys, this is a cyanogas pump, and this pump is used to fumigate the rat burrows, right? It is used for rat burrows. Now guys, all the questions related to entomology, vector-borne and zoonotic diseases, I have discussed again just for the revision. If any one of you missed the question, now you are in a position to know what mistakes you made in the previous quiz sessions, right? So now I am entering in the section 2 of my wrap-up series. My wrap-up series section 2 is about all the images related to the topic. So guys, this is egg of Anopheles. It is boat-shaped egg. This is the Culex raft-shaped. Can you see here the raft? This is like a raft. And Aedes, they are cigar-shaped. They are cigar-shaped. And Mansonia, they are star-shaped. They are star-shaped. If I talk about adult, it sit at an angle. Adult Anopheles, it makes an angle with the surface. If I talk about the Culex, it has the hunchback appearance. Culex has a hunchback. If I talk about Aedes, then spotted. See the white spot. This is Aedes. Now, bachcho, this is everyone knows. If you have attended my class, everyone knows the celebrity insect sandfly. The celebrity insect sandfly. Anyone? Can you write in the chat box? Celebrity. It has long legs. It has long legs. Hairy body. Long legs, hairy body. Right? And it is a nocturnal bite. Nocturnal bite. Right? Nocturnal bite. This is a rat flea. This is a wingless creature, no wings, and it cannot fly, so it hops. It jumps from here and there. Very good, bachche. Lanceolate wings. Right? This is trombiculid mite, also known as berry bug. This causes scrub typhus. Now, bachcho, the images related to the topic related to block 1. This is Ishar. This is the black spot seen in scrub typhus. This is yellow fever vaccine certificate. One very important MCQ related to yellow fever vaccine. What is the strain for yellow fever vaccine? 17D. If they ask you till when the vaccine certificate is valid, validity is lifelong. Yellow fever vaccine certificate valid for lifelong. Lifetime it is valid. Last question. If someone is coming from endemic area with no vaccination certificate, what will you do? Quarantine for 6 days. If someone is coming from the endemic area and not having the vaccination certificate, you quarantine them for 6 days. Why 6 days, bachche? Why? I am waiting. I want your answer in the chat box. Why 6 days? Why you want to quarantine for 6 days? Why you want to quarantine it for 6 days? Anyone? we are almost done with our today's discussion. My plan was to keep it between 30 minutes to 35 minutes, hardly 4-5 minutes more, right? Maximum incubation period, very good bache, maximum incubation period, because the incubation period for yellow fever is 3 to 6 days. And 6 days is the maximum incubation period. Now, bacho, what is this RK39? This is a diagnostic rapid test RK39 for which disease? Kala Azar. Kala Azar. Now, if I talk about rabies, this is category 1. This is category 1, only lick by the dog. This is the scratch, category 2. No blood is seen in scratch. Remember, if you see even a single minute drop of blood, it becomes category 3. It becomes category. What do we do in category 1? Wound management. Here, along with wound, we give vaccine. And here, along with wound vaccine, we give immunoglobulin. We give immunoglobulin. But your last question, my last question. Name a situation where in category 2 I need to give immunoglobulin. Listen again. Name a situation in chat box where in category 2 of animal bite I need to give immunoglobulin. Yes, I am waiting for your answer in the chat box. I'm waiting for your answer in the chat box. Name a situation where I need to give immunoglobulin in category 2 patient. Very good, Bache Supreet. Very good, Bache Supreet. Proud of you. Proud of you. Very good, Bache Ananya, Safia, Akshit, Luka, Prakash. Bacho, very good. If it is a category 2 but immunocompromised, give immunoglobulin. Right? Now, we are entering to the last section. And if you have attended my previous wrap-up sessions, this is the rapid fire. Rapid fire means I want my chat box in rapid fire. I want you to reply because this is going to be one-liner. For revising whatever we have studied, this is the one-liner and I want your answer. Okay, can we start? Can we start? Can we start? Can I see some fire in the chat box? Can I see some fire in the chat box? Can I see some fire in the chat box? That fire emoji in the chat box before I go ahead. Boat-shaped eggs. Yes, bacho. Anopheles. Raft-shaped egg. Raft-shaped egg. Culex. Breeding place for Anopheles. Clean water. For Culex, dirty water. For Aedes, artificial collection. Who is the sophisticated mosquito? The person who wears clean clothes is a sophisticated person. The mosquito which breeds in clean water is a sophisticated mosquito. So here the answer is Anopheles. And the one who wears dirty clothes is a nuisance person. Here also, Culex is a nuisance mosquito. Very good, bacho. Very good. Again, last. Hairy body, long legs, lanceolate. If you get these 3 keywords, sandfly. Wingless, cannot fly, rat flea. Name a disease under national vector-borne control which is not spread by mosquito. It is Kala Azar. It is Kala Azar. Uncomplicated Plasmodium vivax. What is the treatment? Chloroquine plus primaquine. For falciparum in northeast, ACT-AL. Other than northeast, ACT-SP, sulfadoxim and pyrimethamine. Short-term malaria prophylaxis, Doxy. Long-term malaria prophylaxis, Meflo. What is DEC provocation test? In which disease we do DEC provocation test? filariasis, where DEC is given 100 mg. It is 100 mg, only 100 mg it is given. Filariasis MDA ivermectin, DEC albendazole. What is the filariasis treatment बच्चों? DEC 6 mg per kg for 12 days. Transmission assessment survey is done in filariasis. Insecticide for sandfly control for Kala Azar. Insecticide for sandfly control. Synthetic pyrethroids. Earlier DDT. RK39 positive in Kala Azar. What is the drug of choice for RK39? Liposomal amphotericin B. Liposomal amphotericin B. With this, I end the discussion. Thank you so much, bachcho. I hope this quick 30 minutes are fruitful for you. And thank you so much for your patience. God bless you. Keep studying. Now what next? So block 2 schedule is already there on Telegram. It is already there on Telegram. What is the Telegram group? Ks_PSM. Every day 9:30, right? Every day 9:30 and 10 questions, right? So bachcho, keep studying, and you must be knowing that on DAM's YouTube channel we are conducting, on DAM's YouTube channel also we are coming, right? So I'll be coming on 16th on DAM's YouTube channel to discuss all the DVT related. Do attend the quiz. Thank you so much, bachcho. Thank you so much, everyone. Thank you so much. So I hope you recalled everything, right? Dr. Bhavya is asking SAS protocol, that IMNCI SAS protocol. I'll be sharing it tomorrow. Tomorrow you'll get the video, bachche. Tomorrow you will get the video. Okay, thank you, Akshat. Thank you. Keep sharing. Bachcho, keep sharing in your groups also, right? Lick on broken skin is category 3. One student is asking, lick on broken thing, category 3. No, tomorrow it is not mine, it is other faculty's session tomorrow, not mine. Mine is on 16th. Chalo bachcho, good night, take care, and let's get back to the schedule. PSM done for the day. बहुत ज़्यादा PSM को नहीं देना, right? PSM done for the day. Let's get back to the schedule. See you tomorrow, and with the block 2 schedule. And check my Telegram. I have shared the block 2 schedule, right? All right. Thank you so much.